because I'm now joined by the associate editor of the Daily Telegraph, who brought this story to us this morning, and GBNews' very own. A few weeks ago, she was grilling me, and now I have her here as a commentator, Camilla Tominey. Thank you so much for coming in.
Good evening, nice to see you.
It's great to see you. You were quite lockdown sceptic from pretty early on, weren't you?
Yes. I mean, I think as a newspaper we were trying to have a look at this diktat of following the science and find out whether that was actually happening and whether the science that was being followed was comprehensive and representative of the entire picture. We know and we understand why the impetus was to protect the NHS and to save lives, and people willingly obeyed that diktat in the early stages of the pandemic because there were many unknowns and we were dealing with an unprecedented set of circumstances. However, as you have just alluded to there, Jacob, as the months rolled on, I think it was only right to apply a degree of journalistic scrutiny to some of the advice that was being received by ministers and the decision-making of ministers. And don't forget that that decision-making seemed to shrink somewhat. You know, in the past we've talked about Tony Blair sort of operating in a sofa government style. What was happening is that small committees were making decisions that were then being rubber-stamped by the wider cabinet. There was concern perhaps that decisions were being made on instinct and gut as opposed to by following the proper public health protocols. So what the lockdown files do is they sort of lift the lid on some of that decision making, not so much a sofa government as at times a government by WhatsApp. We appreciate that that only represents a fraction of the conversations that were taking place at the time. But what these messages do reveal, and let's face it, there's 100,000 of them, there's 2.3 million words that the investigations team at the Telegraph have poured through. What they suggest is that sometimes decisions were being made for political reasons, for PR ones, and I think the public has a right to know when their lives and their liberty were put at stake in an unprecedented manner, how some of those decisions were taken.
And one of the things that's been highlighted is that the decision on masks in schools was made because Nicola Sturgeon had done it and they didn't want to have a row because she'd done something. There was no medical evidence for it, so we were told we were following the science. But if these WhatsApp messages are right, and I know Matt Hancock's been saying that they've been doctored and so on and so forth, and we'll see about that.
They haven't been doctored, just to clarify.
But he's been saying that, so we need to note what he's said.
Sure.
It was being done for purely political reasons and PR reasons,
yes.
And people's lives were being made less comfortable just to keep up with Nicola Sturgeon.
Well, if that's what these messages suggest, and we know at the time that there was a great deal of confusion over the efficacy of masks, not least because you had those in the medical profession saying they'd only be useful if they were literally surgical and being put on and then put in a bag and then hands washed, etc. And yet the government was recommended that we made masks at home. Some decisions were made because of the optics. There's still intrigue around this comment that Matt Hancock made in the message when he decided to go against Chris Whitty's advice on testing all people coming into care homes as opposed to just those coming from hospital, that it muddied the waters. Muddied what waters exactly? Muddied waters on his testing ambition for 100,000 tests?
Well, I thought that actually came across in a different way, and that what he was saying was that there simply aren't enough tests to test everybody going in, because that's very early on, isn't it? That's April 2020,
sure.
And they're trying to boost the testing. They know they can test everyone in hospital, but if they try and test everybody in the community as well, they wouldn't necessarily do everybody in hospital, and they had limited resources.
The counter-argument to that would be, if there was a problem around testing, and in fact the government guidance, it wasn't until the August of 2020 where it was mandated that all going into care homes should be tested from community and hospitals. If that was the case, why was he using the terminology early on in the pandemic to suggest that a protective ring had been placed around care homes? What we know because of the diktat of April the 2nd, which said that people could be released into care homes without being tested, and I appreciate that hindsight does a lot of heavy lifting. Anyone involved in care homes, and I can speak personally on this issue because my father runs one, he's a retired GP who's worked in the care home sector for decades, could have said that that was not the right decision to take. You know, Dad had to shut down his home before he was advised to do so by the government because of all of his medical training suggested that his residents were going to be the most vulnerable against this disease.
And wasn't there a fundamental problem about the whole line on save the NHS. Isn't the NHS there to save us?
Yes.
Rather than the other way round, that the NHS is the servant of the state rather than this great body that we all have to operate to help it carry out its business.
Yes, and also that quest to save the NHS at times put private care providers in a precarious position because, as Helen Whately, who was the care minister at the time, had pointed out to Matt Hancock in these messages, a lot of the PPE was going straight to the NHS, and so private care providers couldn't get the PPE they needed. I remember my father saying about how he'd had 400 masks delivered and they were kind of old-style tie at the back ones. They were completely useless for barrier nursing. So you then had the government in this strange predicament of saying to the care sector, you must take people to free up hospital beds, but at the same time not adequately equipping them. Even in September 2020, my father had written a piece for the Telegraph saying that the testing situation was in a fiasco. You've spoken about your family situation. At one point, we had 150 tests at the care home go missing. You then have the situation of asymptomatic residents and carers, perhaps spreading the virus among others. I mean, it wasn't plain sailing, and I don't think the care sector felt that they had a protective ring around them.
Well, I think so often you show the virtues of a free press that ensured these questions were raised, even as the pandemic was going on. Thank you so much for coming in. Don't forget to tune in to Camilla's show. Camilla, as I said, interviewed me a few weeks ago, this Sunday at 9:30.